Hello everyone, I'm Shahid Nazir Mohammed. I am pleased to have been invited to present this short presentation on having been shortlisted for the Impact and Innovation Scholarship at the University of West of England, and the project being put forward on behalf of the Renal Patient Support Group. This sort of project really is around using art to raise chronic kidney disease awareness. The project is titled Chronic Kidney Disease, or CKD, through art. Um, uh, this research has or this project has and research really has three main missions, mission and core vision. The concept is novel by three parts. In the first part is to help gain a broader understanding of how people with advanced chronic kidney disease, or CKD, receiving different forms of renal replacement therapy cope with healthcare through how they cope through their conditions, and highlighting that through art. Number two is to seeking to involve it to solve issues around health literacy, where patients may have challenges conveying understanding around aspects around their health, and to complement that understanding, or supplement that understanding, using art to open up health dialogue between professionals and patients in pediatrics, or young people, and going through kidney disease, and adults going through kidney disease or kidney care practice. And the third and another main part of the concept and mission and core value is core vision is to implement through a step-by-step research process, formalize a book publication that highlights CKD through art, and this will be both novel and the first of its kind, owing to its link with kidney care and science. The impact around this is by three, also by has plays a role by three main core implements, and that's where the audience and those who are being encouraged to get on board with this book proposal on this venture would be scientists themselves, healthcare scientists, nephrologists or kidney care specialists, allied health professionals working around patients going through chronic kidney disease or kidney disease, patients and carers themselves, and those who are using or are members of the Renal Patient Support Group, RPSG, or the Kidney Disease and Renal Support Group, KDARS for kids. In between the two membership, the membership between the two groups holds just over 10,000 members globally. And so why do we want to make this impact in this sort of way, and through art? Well, basically to help bridge gaps by adding color to CKD, dialysis and transplantation, and what problem is being addressed and solved. Well, basically three main things here is to raise issues surrounding coping hopes and fears around going through chronic kidney disease, to involve two patient organizations, i.e. The RPSG and KDARS, involve media wherever that is possible, and local NHS trusts. And third and finally on this, on where impact is concerned, is to prevent impoverishment, health disparities, and increase health equality, where patients and carers would find it or can find it challenging to navigate aspects of their healthcare through communication, and thus using dialogue in a different way, through art and design. And then the goals are threefold really. Number one, to help identify strengths and limitations of how art posted through social media can help inform healthcare for kidney patients, using qualitative context with art to supplement health practice, highlighting different stages of health and disease. And the scholarship would be used to develop a book publication, again adding color to CKD, dialysis and transplantation, and ultimately where those who are intrigued by this venture, or this the book publication, would be that they can use this as a day-to-day to also record or journal their how they're coping, hopes and fears, in a way to complement aspects of their healthcare. To implement best practice, or to follow best practice, this project would be to implement art and words together. This project was is focused for would be focused over 8 weeks, and there's a series of different processes that we would use or implement to actually fulfill this project, and make this come to fruition. And through the RPSG in the past, we've covered there have been various themes that patients and carers, and on KDARS as well, of course, that patients and carers have said that there have been issues around, or they have faced issues and have found it a bit challenging to put their challenges and duress into words. And so the key, the sort of key main focuses or themes would be chronic kidney disease, the fundamentals, CKD by volume, before CKD, restriction, technology, strength, during CKD, resilience, the ongoing tests, the fatigue, post-transplant, the medication, life is a gift, young people, words of encouragement, support, conclusions, and special dedications. And over the 8 weeks, there would be 5 main areas mapped out, so to ultimately bring this to fruition, and to ultimately improve life for kidney patients through art according to themes. And to summarize, as one of the key applicants, one of the main applicants for this project, I have provided multidisciplinary team working perspective between health sectors. I'm a co-founder, CEO, and an academic and scientist. I have worked in research and industry. I have over 2 decades of experience. I have supervised and mentored. I have published over 260 research items, including systematic reviews, literature reviews, mixed methodology publications, and narrative reviews. I have acquired skill mix to lead and effective research and healthcare guidance for patients, the public, clinical, and scientific practice. I want to say thank you for those who are listening and taking the time to listen to this short overview of this application that was put in for the Impact and Innovation Scholarship under the University of West of England today at on the 5th of July 2021, and it's been a pleasure highlighting this context for your ears, and hopefully if we're successful, then we can see this project bring putting context from health and where there might be health and literacy barriers or ongoing issues, and transitioning that in art to support best practice for patients going through chronic kidney disease, albeit between the pediatrics and young people and adults going through this as well. Thank you for your time. Okay.